Hi, my name is First Jamal, and I wanted to take a few minutes of your time just to introduce myself and tell you a little bit about me and the kind of service you'll receive when you come and visit me as a patient at one of my practices, either in Kenilworth or in Stratford-upon-Avon. So if you're watching this video, you're probably watching on the website, or indeed you might be watching on the Facebook page for Pennington Dental. Wherever you're seeing this video or one of our posts on social media, you may be thinking, who is this chap First Jamal? And could he be the right dentist and the right fit for my family and myself? Well, let me tell you this. My role as your dentist is to help you keep your teeth as healthy as possible for as long as possible. And that means not drilling your teeth, not drilling and filling. Now, in order to do this, I need help from you. This is not a one-way process. It's not something you come and do every 6 months and see the dentist and all is well. I need your buy-in and your help, and we'll help you and guide you in order to achieve this great result. Now, some of you will say that you've already got crowns and fillings. You've already got lots of dental work that's been done over the years by different dentists in different cities in different countries in the world. And all I can say to you is we will do our best to maintain the dentistry you've got. We will work hard to make sure that that lasts as long as it can last, because we both know, you and I both know, that the more work we do on already crowned and filled teeth means we're risking those teeth to be lost. That's not an outcome either of us want. Remember, we want you to keep your teeth as healthy as possible for as long as possible. And that means doing less work, then we're happy with that. So it makes sense to prevent problems arising in the first place. And of course, prevention is better than cure, isn't it? When we see issues during our checkups, during our routine checkups, the idea is that we deal with them there and then or very soon after, and we deal with it to a high standard. The idea being that we touch that tooth once and we don't want to have to revisit that tooth again if we can help it. Now, of course, things may happen and the tooth may need further work, but ultimately our goal is to do that touch it once dentistry, to really deal with that problem to such a high standard that we know that's going to last. As long as you look after it, it's going to last for a long time and we don't need to return to it. And that means we can progress and deal with the other things going on in your oral cavity, deal with those fillings and crowns and bridges and whatever we see during our routine examinations, and make sure that we do it to such a high standard that we're not having to revisit it. And once we've got your oral health up to a certain standard, what we're going to do then is we're going to introduce you to the hygienist and establish a bespoke protocol for regular review and maintenance. Because once we've set the standard and the teeth are in good health, we want to make sure that you're doing your homework and we're doing our work to make sure those teeth do not have to be filled and drilled again. So do you know something? The reason I know this works is because this is what I've precisely doing for the last 20 years. I take new patients rather like yourselves and we get them dentally fit. My team and I work with you to get yourself and your oral health to a certain level. And it's impressive because what happens is it not only helps you to maintain your health, your diet, and your teeth obviously, but we see our patients becoming more confident, losing weight because they're eating better, they understand their oral health and therefore they understand their health better. And these are positives that I never knew would come, but I see more and more often. So in looking after teeth and looking after oral health, we are helping you to be healthier in general. And being healthier is a goal of all healthcare practitioners. We want our patients to live longer, have better quality of life, and nothing says a better quality of life than having oral health that is in amazing condition. So I take patients who maybe haven't been to the dentist for a long time. They're worried about the pain, they're worried about the cost, and they're worried about being judged. And do you know what? We are not here to judge. We're not here to look at the past. We're here to look at the present, and we're going to help you to move forward. So please don't feel that anyone is going to look down, anyone is going to be offended or worry or look at you in a different or negative light. We are truly here to care for you and move you forward in your oral health. So with your cooperation, because it can't be done without, we get you dentally fit by working out a treatment plan and a payment structure that works for you. We take your oral health and we improve it. And then we introduce you to a maintenance plan. And these are very inexpensive. And if you do what you're supposed to do and my hygienists do what they're supposed to do, then there's no reason why you can't continue and not have any treatment done. And frequently, the vast majority of our patients have healthy mouths that really don't need any maintenance. They don't need any further intervention. It's just hygienists and home care that really cement and maintain those oral health wins we achieved in that first course of treatment. So if you're looking for a dentist, if you're looking for a new way, a different way of dentistry to be delivered, a more caring way, I'm genuinely interested in your well-being, and I'm genuinely interested in helping you keep your teeth for life. So what I say to you is, I welcome you to come and visit us. Come in for a checkup, for a consultation, and let's see how we can both work together to help you maintain your teeth for life. I'm not worried about where you're coming from or what the state of your teeth are in. It really doesn't matter to me. My job is to help you from this point onwards. What's gone has gone before, and our job is to look at the present with an eye on the future. So arrange an appointment, come in and see us, and let's see how Pennington Dental and I myself personally can help you achieve that confidence in your oral health and your smile that you so deserve. Thank you so much for listening and allowing me to take some time of yours. All the best, and I look forward to seeing you at one of the practices where we can talk more in depth about your personal situation, your history, and hopefully your future with Pennington Dental. Take care, God bless, and no doubt I'll see you soon.